this is a kind of a famous X-ray, or it's become famous, and we're going to discuss some of this. Hopefully you all can see every bone in the neck is broken, all 7 cervicals, and you should be able to see C3 in front of C4. It's a total scallop decapitation. The vernacular for this is a hangman's fracture. So I see, does anybody, can you all see that this is C3 here, and it belongs back up on top of here? The whole head neck is out of line. Does everybody see that? Okay. Is anybody this is kind of the discussion part. You know, what would be the diagnosis for this? What would be the prognosis? Anybody think anything about that X-ray? No.
No, that, with my other background, I would say it's a hangman's fracture.
Yes, in fact, that's right. That's the language. When you hang a person, it's an executioner's sign, or that's what they're proud of, is to subluxe that neck. Anybody else want to make a comment here about this radiograph? Why don't you come on up here? We just happen to have a physician in the audience. All right. You'll have to use the mic there, Coach.
Are there other doctors in the room here? Medical doctors? MDs, DOs? Nurse practitioners, PAs?
No.
Well, the nice thing about this X-ray is you have to be a doctor to read it. Let me just show you a line of where the vertebrae should be. I can see it. Close.
Your glasses?
Well, I'll point Jim for you.
Yeah, you point.
You do 3 or. Okay.
He's going to do my point.
Does everybody see the column coming down here? Right, everybody?
Right above his finger. That's the bottom of C3, the 3rd cervical.
And everybody understands that whole head and neck belongs back up on top of here?
On top of C4. So it's anterior, inferior, subluxed. Guess where the cord is? Right behind the vertebrae. What happens when something slides out like that?
Takes it off.
Gone. Cord gone. Which means there should be no innervation below C3, which is, you got to have breathing muscles. So there should be no breathing to speak of. And so this person...
What else is behind the vertebral bodies?
Oh, vertebral arteries. They're toast. They should be. There's a little in the spinal processes. There's a little canal for them to go through. They should be toast.
So a reasonable-minded person, what would a reasonable-minded person say about this radiograph?
You don't have to be a doctor to answer.
Great.
He's dead.
He's dead. Okay. Is there a consensus that this person's dead, right? Everybody agrees with that?
Yeah.
Okay. All right. So this was, now that you've taken the bait, we will show you who that person is. That person is me. And that's me. And I spent about a year of my life as a quadriplegic. You all can hear me, right? I don't need that mic.
Is it being recorded or anything?
You're okay again.
So basically, it was my first date with my wife, and I was showing off. Yes, I am Polish. I dove into 6 inches of water and was immediately quadriplegic. Okay. And then they flew out a life flight, a helicopter, had to land in the river on a sandbar to rescue me. And I was flown into St. Joseph's, where my brother was.
Let me pick it up from here. So I'm his brother, Jim, the missing doctor. And I read this X-ray before. I love X-rays. I'm a family practice doctor. I was in medical school at Creighton University in Omaha, Nebraska. And I was on call that night, or else I had been out canoeing and jumping off of cliffs in the shallow water with him. But I went in, the kind of the policy at Creighton was, there's an interesting x-ray, it's going to be crowded with people in ICU, it's an x-ray room. And so you just walk in and you read it. So I walked into the front and picked it up and did my best. And I described it like this. And then when I was done, I said, boy, this is obviously a dead man. Where'd you get it? And the whole place was quiet. You could hear a pin drop. I thought my barn door was down or something. And then I looked at it, and I saw the name. You're supposed to look at the name first. Nobody does. And so I said, where is he? And he was in the other room. Well, it turns out that the neurosurgeon came in, and Tim was able to ask him, what's my prognosis? And Tim was like a talking head, disconnected from his body on this bed.
And with even half my vocal cords paralyzed, because it got the laryngeal recurrent as it came across.
Kind of just not his normal self. He spoke quietly. And the neurosurgeon said, well, you aren't supposed to be alive. Scientifically, you're not supposed to be here. And he said, but you're here, we've seen things like this, they don't make sense. He said, my experience as a neurosurgeon is if you last 48 hours, and that's a big if, you'll be here. And Tim said, oh, great, 48 hours, I can do that. And he goes, well, I just got accepted to medical school. Will I be able to practice dentistry? And when can I get back to work? He goes, listen, we poke pins through you. You don't feel anything from here down. You can't move anything. We don't know why you're breathing. You won't. You won't do anything from here down, ever. And, 48 hours, I was sitting there as a medical student. Tim was harassing me. He said, hey, my foot really hurts. Right. You punctured nothing. My foot's killing me. I'm like, oh, yeah. Well, that's called phantom limb pain. And he goes, well, I'm moving my big toe like crazy. Look now, look. And I look. Nothing. A little later, he said, I'm moving like crazy. Look. Nothing. So in 48 hours, I'm like, die already.
You can choose your friends, but you can't choose your family.
That's right. So 48 hours, like on the dot. It happened to be Pentecost Sunday. And he says, just look one more time. And I'm getting a little depressed, actually, And so I pull the sheet up, I look, he said, I'm waving it like crazy. And I looked at it, millimeter, maybe, this is a coincidence, must have been a breeze. And let's do it again. No, he did it, a millimeter. And, well, lo and behold, he recovered completely. I mean, the brain was still, but
Yeah,
other than that.
My dad has a theory on that. He says the foramen magnum's about this big, so he says, I figure your brain's about that big. Think, Dad.
The ripcord effect.
All right. Well, our purpose of that is to always have a little faith. This is a picture of my little brother, Jim, and I. And Jim is a hospice medical director in Missouri and board-certified family doc. And he's going to also tell another kind of confounding story.
Yeah, we were both trained at Creighton, and then I did my residency in Kansas City, University of Missouri, Kansas City. And we kind of have a background. We have a little sister, 13 kids in the family. The youngest had Downs, Kathleen. And she profoundly affected the trajectory of our lives. And really, about anybody she came into contact. Tim and I like to think we make a dent in something. She changed the world. And she just passed this January this year. She was 46. And she developed a neurodegenerative disorder and kind of lost everything except she could blow kisses and say love. And,
She also was born with that.
and she fit the video we had earlier. She had the esophageal, what was it called? Duodenal atresia. And so that came, our family doctor that delivered all of us, we loved and admired him. And he came and dad and said, listen, she's mongoloid, she's gonna be grossly retarded, you have your hands full, Luke, you know, just let her go. And he had never given bad advice before. So we thought, his dad said, well, gee, do what you can to save her, but I'm gonna go talk to the family. So he actually left the hospital, came, and the kids, we had a family conference, and he said, well, this is what he's told us, and what do you think? What are your thoughts? And each kid kind of gave a thought. And I remember one kid said, well, you know, if a squirrel or a rabbit comes in the yard with a broken leg or a wing, you always bandage them up, and then they cripple off, and they start flying again. Everything's cool. How about our little sister? Wouldn't you do that for her? And I remember I said, I was 12 at the time, and I said, you know, maybe she gives us nothing. Maybe we can't play catch, you know, play ball. Maybe we can't, you know, get anything out of her. But she's here. Doesn't she deserve to be loved? She's here. And anyway, that changed our lives. And I think of myself, anything good in me is largely due to her, very, very much due to her. But, well, in my hospice scenario, I get to have, man, I heard a lecture today, somebody had a hospice, and the hospice nurse treated somebody horribly. Said that they're at pain, she said, get used to it, click. My hospice is not like that. We listen, we care. So I'm the medical director of Hospice Compasses in Branson for 20 years, and we normally have older people that get sick and they're told they got 6 months to live, and then we help them live. And hospice, you are ambassadors of hope, not the angel of death. And we get them laughing, and we get them to talk about things. They're alive. Just because they have a bad diagnosis. And a lot of them live longer than 6 months because they've been loved and cared for. And some of them actually get better. Well, this little guy, this is Ben, and he was put on he had osteogenesis imperfecta and a rare bone condition where you break tons of bones. And he had the worst, what was determined the worst one, where you die usually in the birth canal. He didn't die, but he had a little hydrocephalus, and he broke a lot of bones coming out, and he went on a C-section. And he was just kind of a bag of bones. And one of the leading experts in the country said, hey, you know, he's got weeks, you know, maybe a month, you know, keep him comfortable. So we took him, and every week we talk about the patients, and they said, what do we do? You know, how do you pick them up? You don't want to break a bone. And these were legitimate questions that they've never had before that. Fortunately, I grew up with it. This guy has osteogenesis imperfecta. Half of the family did. And so I was pretty familiar with it. I was holding traction on broken hips in the backyards as a kid growing up. And that's what made me decide not to go into medicine. I seriously, I was not going to go into medicine. I just fell in after 3 years of pre-med. God knows. I don't know. But then I found out I love it. But anyway, this little guy, they did pick him up. And I said, you know, you hold him, you feed him, you love him, you sing to him, you talk to him, just like any baby. You know, this is your chance. And then a little while later, they said, you know, the mom's not bonding. She doesn't want to bond. She's going to lose him. Do you blame her? You know, I said, no, I don't blame her. But I know she regretted if she doesn't, having been there. You know, you got one shot. Today is your shot. Anybody you love, you better know you love. Let them know that you love them. This is your one shot is today. And I said, you tell her that she needs to, it's going to hurt, but it'll hurt a lot less if she loves this little one. And she did. So the baby started gaining weight and doing better. You know, smiling up at the appropriate age mark, 3 months. Or no, before that. She was smiling away. And he smiling away. And he just wasn't dying. He's getting not bigger much, but he's gaining weight and doing well. And everybody loved him, fell in love with him just instantly. And so I said, you know, in fact, early on I said, if there's going to be a miracle in hospice, which there are occasionally, somebody will just, all of a sudden, cancer's gone. Just blew away. And I said, it's going to happen in a baby. If there's going to be one, it'll be in a baby. And so let's just be open to that idea. And then the baby kept doing better. So I said, we got to get another specialist to give us an opinion. And there's not too many. So we got one. And the specialist said, gee, you know, it's kind of like the neurosurgeon. If he's alive, he may live. He may live a long time. And sure enough, he has. They brought him into my office when he was shy of 2, and he smiled and told me a joke. Prior to 2, told me a joke. Knock, knock, who's there? Orange. Something like that. Aren't you glad I didn't tell the joke? And then he sang a song. I sang a song with him. And then the dad said, you know, that's the doctor that saved your life. Oh, it wasn't. You know, but he goes, and then the little boy goes like this, thank you, thank you, thank you. Like that. Most kids aren't talking to speak of before they're 2. But he's telling jokes. This is when he's about 7, I believe, and he's just doing great, fantastic. And we didn't break any bones in that picture. But we have other folks. You know, other folks in hospice pass. But when you have hospice and ambassadors of hope all around them, foreseeing their needs, your constipation with the medicine, or you can't sleep, or anxiety, or you have no plans about where you're going from here, they can talk about all these things and give them peace. And I've explained to my hospice, and our hospice compasses kind of ascribes to the feeling that in medicine, there's times you're saving them. You're just doing every kind of technologically thing you can. Here, you're just loving them. You're accepting them, loving them, laughing with them, and keeping them comfortable. So I've got 10 minutes, I think. Is that right? Okay. So let's see. I have another one that named Willie. He was a big, tall, handsome fella that all of a sudden got Parkinson's and went downhill fast. Prior to that, he'd come in with a bad knee. Give me a shot, and I'd give him a shot in the knee. He'd get up, do the dance, and go. And but what was weird, at the end of every office visit, he would say, you know, I would forget this every time. At the end, I'm saying goodbye. He'd say, Doc, will you pray with me for a minute? I go, okay. And you know what? If somebody asks you to pray with them, pray with them. You know, you don't force anything on them, but be present with them. And I never force anything on them, but I just say a little prayer. Thank you, God, and, for healing them, and don't let me hurt them. You know, this medicine. And he'd be happy to take them. And, well, sooner or later, very soon actually, he was on hospice. And very quickly again, I got the call. And now, as a medical director of hospice, you don't get this call very often, but they go, Doc, if you can get there right now. The whole family's there. He's in the active dying process. It is the lunch hour. Would you do it? I go, I can do that. He's not even that far away. So I drove out there. And as I'm driving out there, I'm going, oh, dear God, give me the right things to say. Because, you know, the whole family's there. And, I don't want to hurt anybody. And so I don't know what to say. We're all there, cars down the street, you know, from all over the country. And I go up there and put my hand on it, like usual, start talking. I just said, you know, Willie, I'm just so thankful that you invited me here. You have to assume that they can hear. So don't treat people if they're unconscious anything other than respectfully, with the dignity you'd want to have. So I start talking to them, and I said, I can't believe it. They called me, you're having a party, and I'm invited, and I could actually make it. And I'm holding his hand, the whole family's looking at me. He opens his eyes, and he sits up. He goes, Doc, I can't believe you made it. I'm And then he's kind of like got one foot here and one in heaven. So he's worshiping God, and he's talking to me. And then he's back and forth. He was never like this before, you know. Great guy, great, and then he's telling me jokes. I'm dying laughing like usual. He's a really funny guy. So I go, oh, yeah. I said, you know, and I said, are you thirsty? He goes, yeah, I am. So he sucks down some water. But wow. So are you hurting anywhere? He goes, if you're thinking that long, I know you're not hurting. You're right, I don't hurt anywhere. That's great. I said, well, you know, I got to go back to my patients, and it was really good talking to you. I got to skedaddle. And so I'm about to leave. He surprised me again. He goes, Doc, will you pray with me before you go? I go, oh, no. What do you do with that? The whole family's there wanting to let him go. So I said, okay. Put my hand on it and I said, well, thank you, God, for Willie and for this day, this little celebration. I said, I asked you to tell me what I was going to say when I got here. This is why. I said, you know, we're all ready to let him go. But he's drinking down water. He's telling jokes. He's, you know, he's great. But why do you ask you, Lord, in your mercy, if you just might let him just be with us, you know, be with us. Because he's a great guy to be around. And so that left. And nobody threw tomatoes at me. Drove down the road. Well, 3 months later, they called me. He's in the active process of death. What? 3 months? I mean, he looked like death warmed over when I went. You couldn't believe this tall, handsome guy was just, you know, had the positive O sign, not quite the positive Q sign. But called me in again. He looks worse 3 months later. He's been unconscious for 3 days, hasn't eaten or drinking anything for 3 days. So he's in the hospital this time. I go in there and his son's with him. And I put my hand out and said, well, yeah. I said, again, you got me here. I actually had time. I could come over. It's an active dying process, they told me. So he opens his eyes, sits up, goes, Doc, I can't believe you made it. And I looked at his son. This is unbelievable. 3 days, you know, I mean, jeez. And so I go, would you like a little sip of water? He takes a little tiny sip, just to be polite. And then before that day, I kind of had a tough day myself. And I was a little prayer. I said, God, if you just kind of give me some, tell me you love me. I just love to hear that some way today. And so I get there, and we talk a little bit. He's telling jokes and praising God and talking to me and telling jokes. I'm laughing. I got to go, Willie. Got to head back. And he goes, well, Doc, shocked me. Will you pray with me before you go? Oh, no. So I put my hand on his big old hand, big velvety hand, and I said, God, you know, I thank you for letting me come here. And I thank you that Willie's not having any pain. And I asked him, is there anybody you need to make peace with? You know, anybody got to forgive? And no. And, well, how about yourself? You forgive? Oh, yeah, a long time ago. That's pretty good. Most people forget to forgive themselves. And I said, all right. And anyway, so I was praying with him. I said, you know, God, just give him peace. You know, let him just have a great day. And so I leave, and then he passes just within hours. And he's smiling and laughing before he passed. And so he was a graduate. He graduated on whatever that is. Bennett was a graduate. He was too good for hospice. He was getting better. We had to cut him loose. And that happens. And my point is, when you deal with special needs, which you guys all do, you know that they're different. You need to not just treat them and not just, you want to be with them and you want to listen to them and you want to be affected by them. Because if you miss that opportunity, you really missed a lot. These guys changed the world. Well, when you're in hospice, every single one of us, if we're lucky enough to go to hospice, because it's a real honor, we become special needs. And we don't want to be treated. We want to be listened to. We want to be treated with dignity. And we want to live. And I guess that's my point. So things that are a lost cause, they make you think about, hey, there's something out there. There's something, I don't know what that is to you, doesn't matter to me. but there's something out there, and I guess I would call that love, the name for that that's out there. You know, some people say God is love, all who live in love. And so I would say make sure that you get in touch with that as much as you can with the people you see. Because like Tim said, he works on these special needs kids. He said, I touch the face of God. It's in their mouth. And we do too.
All right. How much time we got left?
We have about 5 minutes.
All right. This is obviously Jim, Kathy, and myself. And what we're going to do real quick is I'm going to play this video. I think if I get it to work, and then we're going to if it's all right with you guys, we're going to sing you a quick song.
Yeah, but you tell it.
Jim, you want to grab that? Where's the guitar? Right there. Holy cow! Justin, you want to help me with this thing? I messed it up.
We could just sing a song, let that thing play.
That's
in the background with an open music.
background.
And there's one right below that one, you can get the school.
That's it. Yeah. Watch.
Yep, just here, rock and roll. Gives me sound, this one, this section. Oh, it isn't all.
Well, the video won't upload for some reason. What it was just a video of so what we do at AT Still. It was Sarah and Dustin helped me do MVR work campaign. And it was a lot of photographs of the kids, and it was just we put it together for you all today.
All the winners.
All the winners. All right, so this song's for you guys.
I gave my love a cherry that had no stone. I gave my love a chicken that had no bone. I told my love a story that had no end. I gave my love a baby with no crying. How can there be a cherry that has no stones? How can there be a chicken that has no bones? How can there be a story that has no end? How can there be a baby with no crying? A cherry when it's blooming, it has no stones. A chicken when it's pippin', it has no bones. The story that I love you, it has no end. A baby when it's sleeping has no crying. I
Thanks, everybody.
love you, man.